My name is Elad Gross. I'm a civil rights attorney, an educator, and a dog owner, and I'm running to be Missouri's Attorney General. Welcome to the EladPod. Who wants to help out with the campaign and has been doing so.
And you do not mess with that.
Yeah. We need an attorney general who's not going to violate the trust of Missourians. Around quite a bit. Once I've got the backs of my hands covered, there's some space right here in between. All right, folks, welcome to the EladPod. We are very excited, one, to have an intro video, which is great already. But two, we have a wonderful guest here today, Dr. Ken Haller. Very excited to have him on. He has done wonderful work in the St. Louis community, and will be here to answer all of the questions that you've got. We will also be playing a new game for those of you who tuned in last week. We have a different one this week, and we're very excited to play that with our guest, as long as his phone doesn't die in the middle of this one. I think we'll be okay here. And at the end, we'll talk about some news about the campaign. We'll talk about some events that you can all get involved in, and also some just news that's going around Missouri right now. It's a very interesting time to be here. So let's get to our guest. Very excited to have him on. Make sure he's still here, and hopefully this works. He's there. Oh, this is great. Okay, well, welcome to the pod. Dr. Ken, how are you doing today?
I'm doing great, Elad. How are you doing?
I'm doing well. I'm here. We talked about this right before the pod started. I'm very happy my dog is not causing a ruckus right now. I got to meet yours, Malcolm, which was very exciting.
Yeah. If he comes back into the kitchen, I'll give everyone a look at him. But he's gone off elsewhere, so
that's great. Now
he is his own master.
So that's good to know because now I know who to ask to have him submitted for Missouri Furry Friend Friday. It's him.
There you go.
I should apply directly to Malcolm. That's the way it goes.
He has his own Facebook page.
Oh, does he really? Oh, that's great. Well,
yeah.
We'll get that. We'll put that in the link, and we'll share Malcolm's Facebook page with everybody too. So everybody who's watching, you know that a lot of you do know how this works already. If you do have any questions, comments, or you want to just tell us you're there, that's also great because I know what to look out for, especially if Jimmy's watching right now. But go ahead, you can comment on Periscope. We're live there. We're live on YouTube, and we're live on Facebook. And I'll be monitoring the Facebook for questions and everything else. So go ahead, let us know you're here. Comment, share it. We'll be on for a bit. So happy to have you all with us too. So Doc, could you do us all a favor? Could you introduce yourself for everybody so they know who you are and why they should trust you, despite me? Well, in addition to me saying that they should. So I vouch for them already.
Yeah.
If you could.
Well, yeah. Thank you. I am. So my name is Ken Haller. I'm a pediatrician in St. Louis. I am a professor of pediatrics at the St. Louis University School of Medicine, and I'm on staff at Cardinal Glennon Children's Hospital in their primary care clinic, Donny Pediatrics. I'm also a previous president of the board of the Missouri chapter of the American Academy of Pediatrics, previous president of the board of PROMO, Missouri statewide LGBT civil rights organization, and former board member of the Missouri Foundation for Health, now a member of the board of the Arts and Education Council of Greater St. Louis. So that's the stuff that kind of keeps me busy. I'm also a cabaret singer. And if you go to my Facebook page today, you will see that 5 years ago today, the St. Louis Post-Dispatch named me the best cabaret singer in St. Louis. So hopefully someday in person, I will be able to sing for you on a stage where we can all get together and have a few drinks.
Here's
my stethoscope.
That's wonderful. So you got the stethoscope ready to go. You got the plug. We'll put a link to your Facebook page on there too. It's a very wide amount of especially the community involvement that you're. I always wonder why. Like why are you so? I mean people ask me this question all the time. Why are you doing? You work with kids. You're doing this law thing. You're running for all these different things. I'm always curious. What's your answer to that? Why are you doing so much?
Well, I think that I'm I had a misspent youth. I'm a product of Jesuit education. So I went to Creighton University in Omaha, Nebraska, and which is another fine Jesuit institution like St. Louis University. And I kind of took that whole men and women for others to heart. My mentor there was a Jesuit named Joseph Brown, who was originally from East St. Louis. He's one of only about a dozen African-American men in the Jesuit order. And so when it came time to go into practice, I said, Joseph, I really want to work in an inner city. And he said, well, if you want an inner city, there's no city more inner than East St. Louis. So I moved here and I worked in East St. Louis for 10 years. But as time went on, I also started to realize that healing is it's about more than a stethoscope.
Yeah.
It's about it's about creating a society where that is healthy for kids. That's healthy for everybody, where people are not marginalized. If we want to be healthy, we have to create that society. And art, I feel very strongly that art is also one of the most important routes to healing. Creating art, experiencing art, being an artist is a way that we can heal the world. So for me, my very broad mission is healing in whatever way I can do that, whether it's through medicine or advocacy or writing and performing.
Yeah.
So it's I think it's what Tikkun is about healing the world.
Yeah.
Yeah.
Right. Yeah.
So,
Tikkun Olam. Yeah, that's exactly right.
Tikkun Olam, yes.
Yeah. Oh, that's great. Yeah. My wife would greatly appreciate that. I think she might be now.
Yeah. And that's pretty good for an Irish Catholic boy.
Yeah, that's great. Yeah, no, I'm feeling it. Thank you. Yeah, that's good outreach. Yeah. So I think it's interesting because there's a lot of parallels to how you're describing your job to at least what I've seen in education. I think because so much of working with kids and seeing what they're going through. I mean, you do pediatrics is trying to find what really inspires folks.
Right.
And oftentimes, if you find that connection through art, through something that often, unfortunately, we really don't invest in very much in many of our spaces. Oftentimes, that can be the best way to connect with somebody, and it unleashes so much more potential than you would expect.
Exactly. Yeah. That's one of the things that I mean, honestly, when I was younger, I thought about being a teacher.
Mm-hmm.
But I also realized that doctors get paid better. So, I mean, frankly, got to be honest. But I also find myself as a teacher. Every day I'm teaching parents, I'm teaching kids at St. Louis University School of Medicine. I'm teaching residents and students how to be doctors. And I try to be a teacher in every aspect of what I do. But so much of that really is about art. I actually teach a course, an elective course at St. Louis University School of Medicine for first-year medical students called Acting Like a Doctor. And it's 6 3-hour seminars using the principles of improvisational theater to be a more mindful, empathetic physician, about using the concept of yes and when we're talking to our patients. So that, for example, if I have someone who says they don't want to vaccinate their kids, instead of, my little thought balloon is, oh, for God's sake, here we go again. But instead what I say is I try to put myself in their shoes and I say, tell me what you're scared of. Tell me what you've heard. Right. I see how much you love your kid. Tell me what it is that you're concerned about. Let's talk about that. And that's how we can begin to get to a place of getting to yes for everybody. And that is art. That is art. That is performance. That is being aware of the role we are playing in that moment and fully inhabiting that role.
Right. Yeah. I mean, it's that, empathy that goes so far, because it's, in a lot of, just in the space that I'm in right now, where I'm running for office, and folks who just come on, Facebook or Twitter or something and have a lot to say. I've always found
really?
that, quite a bit, but so a lot of folks are like, hey, beware of the trolls, don't feed the trolls and everything. But oftentimes it's folks who are, I mean, some of them are not real; they're just fake accounts or whatever. But a lot of times it's folks who need to that acknowledgement and that understanding, and they want somebody to be there.
Right.
And I have found that just by doing exactly what you're talking about, just by interacting with folks and being respectful about it and having empathy, and assuming good intentions too, I think is so important, that it really gets you to a better place. And I think it it helps you come to a better conclusion than if you didn't act that way in the first place.
Oh yeah, yeah. I couldn't agree more. I write a lot of long things on Facebook,
Yes, I do
I
too.
generally get positive stuff, but sometimes I'll have someone who counters me, and I will say that that's the kind of thing that makes me think, oh, okay, well, let me think about that. Let me take that in. And sometimes I have been able to engage with people, and we get to a place where there's some things we can't agree on, or it forces me to look at some of my assumptions and maybe question some of them and come up with a more nuanced answer to that. Again, getting back to your original point, I think that when it comes to education, arts education is really crucial. And I think that if we're going to make people who are going to be truly effective as doctors or as lawyers or as whatever profession we're in, having a training in art very early is really key to making us the best professionals, the most caring and empathetic and mindful professionals we can be.
Right, right. Yeah, no, I totally agree. I think one of the, unfortunately, well, there's a couple things. One, art is so important. And I'll be honest with you. So I've been teaching for over 13 years now. And at the beginning, it was like, oh, well, they got to learn math and reading and that's what's important. And that's, but you lose so much of that. The more, I was working with kids, and especially in a classroom environment where, increasingly over those years, I became the authority figure. And there's that, like, right, like this. So I would always wear a tie because otherwise they just think I was one of them. But
Right.
the problem is, I think it's basically like denying somebody part of their brain function, and when they're very much like craving that, the ability to be creative. And I think that
Right.
we really lose so much of that human aspect when we're not thinking about art and just the different ways of expression. That's why we call it expression. It's a different way of communicating and understanding the world.
Mm-hmm.
And it's so important. And I think that we're seeing what you just said was I mean, even in legal education field, I think we graduate so many folks who think, well, I know the law, or I know medicine, I know how to, put X goes with Y to make Z, but they don't know how to communicate that very effectively to the people that we're supposed to be working with, which to me seems like, and has been in my experience, probably the most important part of the job, especially if you
Mm-hmm.
want folks to go along with, the treatment or the recommendations that you've got, because you're trying to serve them as best as you can.
Exactly. Exactly.
Yeah, yeah. So I think it's a great point. So right now, in the world of healthcare and medicine and everything else, obviously we're dealing with a pandemic and a huge outbreak. And Missouri, you've got folks on one side and the other, and now we're talking about reopening everything. What have you? I guess what have you been seeing? Have you been very involved in treating all of this stuff, or seeing like different things happening where you're working? Has this changed anything for you? I mean, I'm sure it's changed something, but
Yeah.
what has been the impact of all of this?
Well, from a pediatric standpoint, there has been I mean, the thing is that kids, luckily, I think in many ways, do not get very sick from this virus.
Yeah.
If they do get sick, a lot of times we don't even know it.
Mm-hmm.
So we have seen very few cases of coronavirus, of COVID-19 in kids that have actually been diagnosed. One of the things we've done in our clinic at Cardinal Glennon, we have two geographically separate spaces, one at the hospital for our clinic and one at a street front clinic on Forest Park Boulevard near Sarah. It's a block from the IKEA store.
Mm-hmm.
And so what we've done is we've separated those two into a well clinic. The storefront clinic is a well clinic, and the one at Cardinal Glennon is now the sick kid clinic. So if kids are sick, they will come to Cardinal Glennon and be seen there. But if they have no symptoms and they're coming in for their well checkups, they come to our storefront clinic. The numbers, frankly, are way down. We're not seeing nearly as many patients because I think quite prudently, a lot of people are feeling like, I don't want to go someplace where someone might be sick.
Right.
What we have been doing is but even with that, even in the well baby clinics, we're all wearing masks. We're as compulsive as ever, if not more, about hand hygiene, all those kind of things.
Mm-hmm.
And what we're looking at is what's called a surge plan in case things get really bad here in St. Louis. So, for example, at Cardinal Glennon, if things get really bad across the street at St. Louis University Hospital, then we will be taking some adult patients over to Cardinal Glennon, primarily non-COVID patients, but we will be caring for adult patients there if we have to. It hasn't come to that, but it might. And same thing with St. Mary's, which is part of the SSM system. If things get really bad there, a lot of the babies in the neonatal intensive care unit at that hospital will be moved over to Cardinal Glennon so that respirators in the neonatal intensive care unit can be used for COVID-19 patients. So right now, a lot of this is watchful waiting. But I will have to say that the fact that that both the city and the county went to stay-at-home orders fairly early has so far served us pretty well. And from the situation reports we're getting, not just at SSM, but at BJC and Mercy and St. Luke's, it does seem that we are reaching perhaps a plateau. And that if this continues, we will be starting on a downward trend. Mm-hmm. Now, of course, that does not mean we can open up right away. If anyone has, heard of the 1918 Denver double hump flu pandemic, they opened up too early in 1918 during the flu pandemic, and their curve went kind of like this, and then it went like this, and it was much worse. Right. So I think we're in a place now where we're doing as well as we can, and I hope that we can continue this and people can stay strong and that we can support each other in this. Mm-hmm. I am very lucky that I have a job and I have a place to go to, although, it's someplace that I have to be careful of because I am over 65. I know I don't look it.
You don't.
Oh, thank you. I am in kind of a risk group, but we all have to be careful. But I know there are a lot of people who are suffering because they don't have work. They are having trouble meeting their rent and getting food and things like that. And the only way we're going to get through this is if we support each other in this, and if we advocate going further for healthcare for all, to make sure that there is a guaranteed minimum income for people so that if these things do happen, people are not going to have to worry in ways like this, not just about getting a disease, but about just being able to eat.
Right. What do you think, looking at just kind of the differences in some of even the practices right now that you're describing, but also thinking about what this virus has really exposed in American healthcare and really American society. What do you think, going forward, once this is done, what do you think there will be a lasting change in healthcare, or like big pushes as a result of this, where there might be more consensus than there was before?
Well, let's put it this way. I hope so, and I think it's something that we all have to push for. Honestly, as the Democratic nominating process was going on and the debates were going on, I've always been a proponent of a federal guaranteed health system. What's sometimes called Medicare for all. However, I did really wonder if it was practical because there are so many people who have insurance that they're reasonably happy with, that has done well for them because they have a good job and they have all of this stuff, that it seemed like it would be impractical to push for that because so many people would not want that. And so what I thought was a more appropriate way of going about this was making sure that the Affordable Care Act was improved, that there would be a Medicare for those who want it, and that over time, as this all went out to the marketplace and people with Medicare, at any age, when people with private health care would see what they could actually get through this federalized system, they would start to push for that. I think this is going to accelerate that process so much. And I think that once because I think what's going to happen is that as this crisis goes on, as people lose their jobs, as people lose their health care, and then they get sick, more and more people are going to find that the insurance companies are frankly kind of screwing them over. And that they need to know that if I get sick, if something happens to me, I am not going to be devastated by this. I'm not going to lose my house. I'm not going to lose my savings. I'm not going to lose my 401k because I don't have health care. And I think that this is the kind of thing where we can look at this and say, once this is over, we cannot let this happen again. Everyone has to be guaranteed health care.
Yeah. It's interesting because Missouri is one of the few states that hasn't expanded Medicaid at this point.
Yeah, I'm aware of that.
What are your thoughts about? Yeah, I'm sure you are. What are your thoughts about that?
Missouri has, in many ways, allowed itself to be ill-prepared for such an eventuality as this. And one of the ways is by not accepting Medicaid expansion. And this has been incredibly frustrating for every one of us who is in healthcare, as well as for the hundreds of thousands of people who could and should have this. If nothing else, what it has done, it has caused a number of rural hospitals and clinics to close because they simply don't have the support. And now if people in those communities get sick and they need to be hospitalized because of COVID-19, they're not going to be able to get it. For years, we have known that people are dying in this state because Missouri did not accept Medicaid expansion, and this is only going to make it worse. I know that there's a push to get this on the ballot in November, and I certainly hope that succeeds, and I certainly am going to advocate for that. I would also hope, and it may be a vain hope, but if there are special sessions coming up this summer, that perhaps there might be a push to get it happening.
Right.
To get that happening before there's a vote, because we can't afford to let more people die of this.
Yeah. I think you're totally right. It's not, having traveled before the virus, having traveled all over the state quite a bit. I remember being in Nevada, and there was a doctor who was presenting because their hospital wasn't doing too well, and they needed to have it funded. So he was pushing for a local tax increase to fund it. And somebody asked, "Well, would Medicaid expansion have helped?" And his answer was yes. And he's a Republican. It doesn't matter, like whether you're Republican or Democrat or nothing or whatever you are. Disease doesn't check your membership card before it does something.
Right.
And it's unfortunate that so many studies have come out, and there was some recent ones from WashU not too long ago at all that came out and said that the state of Missouri had a bunch of different types of estimates, but in all likelihood would save quite a bit of money expanding Medicaid. And right now we're leaving money we're paying for. We're already paying for it in tax money. We're just sending it to different states, and we're not doing it. And we're leaving so many folks without access to affordable care. You're exactly right. We've left our state in such a vulnerable place, and here we are.
I agree. There are so many people have had to quit work because they have health conditions that won't allow them to work, that could have been cared for if they had Medicaid, would allow them to work and become taxpayers. This is how this system gets paid for. Missouri has sent billions of dollars to the federal government that has gone to other states because we have not accepted Medicaid expansion. It has been incredibly short-sighted on the part of, and I have to say it, Republican legislators, because they're the ones who keep voting this down, to not accept this and to block this. And we have paid a price for it, and we're going to continue to pay a price for it. I will say that as a pediatrician for a long time, Missouri has been fairly good about paying for care for children. But as we know, in the past year, 100,000 kids have been dropped from Medicaid rolls because of the terrible job that the department has done getting people re-enrolled. So no one is safe from this. people are sick and they're dying because they don't have health care coverage, and it is unethical. It is immoral. We have to get this. We have to get this moving.
Right. Yes, and you're totally right. And I'll go a little bit of a step further. But the legislator, after the 100,000 kids were kicked off of Medicaid, because basically what happened, they had this electronic system, and they updated. They didn't really check it apparently because it just started kicking people off who were eligible for health care. And the response was, well, look, we're saving the state money. It's like, no, you're not. Like, you're hurting the most vulnerable families, and if you can't access healthcare, we're all in trouble. And then finally, after weeks and weeks of this, finally the legislature accepted. I should say again, it was the Republican side of it. Unfortunately, it was a very partisan issue, and that they finally accepted that. Oh yeah, we made a mistake. But you know what? It's not our responsibility to fix that. The parents should have fought harder to get their kids re-enrolled. And I mean, it's so frustrating to see that's the attitude, right? So
so if I haven't said this already, and I do need to say this, for purposes of this podcast, I'm speaking as Ken Haller citizen, and not as a representative of any of the organizations I have been affiliated with or am affiliated with. The reason I say that is because in my professional role in all of these organizations, I have always been nonpartisan. I am happy to accept good ideas from any legislator or any executive or any policymaker. The problem is that the policies and the proposals that come from the Republican side of the aisle are almost invariably the ones that have hurt kids. And frankly, when the governor of this state, when he in his State of the State address talked about how wonderful it was that we were saving money by kicking all these people off of Medicaid rolls, it is one of the few times that I have said on Facebook, what the hell is the matter with you? It was just too much to hear that this incredible bureaucratic snafu was being lauded as a way to save the kids, to save the state money on the backs of sick children.
Yeah. And I mean, I'm very much with you. I'm not a big partisan guy. I think that there are wonderful ideas from all over the place, but the problem is, especially in Missouri right now, it is so frustrating because we're a governmental system of checks and balances, and part of those checks and balances is also, over time these parties developed, and we've got a two-party system for better or for worse in Missouri for the most part, and in America. And when you have that system, but you have your local government, which has so much control that people really don't realize, because we always look at national politics because they got the biggest cameras, but we don't. They have so much power, and when that power is so concentrated in one party, and there is no accountability, there are no checks on that, you get some really bad policy. One thing that I've been talking a lot about on this campaign is this dark money stuff. And for those of you who haven't listened, you should definitely check out the website. But dark money, it's this anonymous campaign contributions. We don't know where it's coming from, but it's interesting because that money always follows the party that's in power because people know who to invest in. And I think that's why you often see in like states where it's heavily Democratic or state that's heavily Republican, you often see these policies getting pushed that are just not great for people because folks who have a lot more power than either one of us and a lot more money than either one of us, they know that those are the people they can push things through. And it's just so sad to see, whether you're Republican or Democrat or nothing. It's such a broken system right now, and it's frustrating. And so, I'm like you. I really don't like calling out one party or another just because it's that party. But I mean, that's the pattern we're seeing in Missouri because it's so slanted one way, and there is no balance right now.
Right. So, exactly.
Yeah. So we have had a few questions. One of them has come in through Twitter. Let's see. I'm going to try to do this thing again. I think I can bring it into the broadcast. I'm really excited. I got all these toys and everything over here. All right. So I added on. It's an overlay. Okay. Is there a concern that kids will fall behind on immunization schedules and we will see other epidemics? What do you think about that?
That is a real concern at this point. So I'm glad you brought that up. One of the things that, in fact, there was an article in the New York Times the other day looking at the fact that there has been such a dramatic fall in immunization rates, particularly in kids under 2 years of age, that we are looking at the possibility of epidemics of things like pertussis and measles going forward.
Mm-hmm.
Vaccines, as you know, we all know, are incredibly important. They have saved millions of lives. And getting vaccines, there are a series of vaccines that are given between 2 months and 18 months of age. There are also vaccines that are given at 4 years of age, 11 years of age, and so forth. Those can wait a month, 2 months, whatever. But these that occur in the first year of life for things like pertussis, for what's called pneumococcus, which causes infection of the brain and spinal cord, called meningitis, of Haemophilus, which does the same thing. These really need to be done on time. The Missouri chapter of the American Academy of Pediatrics has put out a very strong statement. In fact, nationally, the American Academy of Pediatrics has put out a statement on the importance of getting these vaccines done and getting these visits done. I know that every office that is in our network of the Missouri chapter of the American Academy of Pediatrics takes everything very seriously. That when we see patients, when you call for an appointment, there will be a series of questions. What sort of appointment do you want? What's the status of your child? Is this a well child visit? Does your child having any symptoms? Every office is doing what they can to separate out sick kids from well kids and getting kids in and out as quickly as possible to get those vaccines. The last thing we need on top of this is having an epidemic of whooping cough. And unfortunately, that is something that's still out there. So thank you for asking that. Call your pediatrician's office, get your appointment set up if your kid is under 2 years of age, and we will do everything we can to keep everyone safe.
Yeah, great. Okay, good. That was a good question. Glad. I think that might have been my mom who put that one out there on Twitter.
All right.
She does a lot of work.
Thanks, Mom.
So good job, Bob. Yeah, let's see. Hold up. I had a question over on Facebook too. I'm pivoting from one to the other. This is great. Yeah, I think we talked a bit about this, but I do wonder if there was anything that maybe you were seeing specifically before. So question from Lexi is, can you speak to how heightened public awareness of health and wealth disparities could translate into an opportunity for legislative or policy change? How do we push back on business as usual?
I think that's a really good question. We talked about this a little bit, but I think that this can go beyond. Getting healthcare for all, I think, is really important. This is the sort of thing where there are organizations in the state like Missouri Healthcare for All. Mm-hmm. I would look them up. They are doing a lot of work on this very subject. Getting involved with them, if you are. But beyond that, I think that health and wealth disparities. One of the things that has become a real issue is the idea that was brought up during the primaries about a guaranteed minimum income. Why should people have to? Honestly, this is one of the things that drives me crazy. I take care of people from poor communities. I have never had someone come into my office in 30 plus years of experience who is just happy to sit at home and get their welfare check and live off the state. Mm-hmm. Everyone who comes into my office who has kids is working 1 or 2 or 3 jobs.
Yeah.
Most of them for minimum wage. They have to take buses all over the place. They are scrambling to get health care for their kids and get daycare for their kids and get their kids to school. Honestly, if I were living in circumstances like that, I don't think I could make it. Mm-hmm. Everyone deserves to have a place to live. Everyone deserves to not go to bed hungry. Everyone deserves to get health care. If we can provide that minimum for everyone, then people will be incentivized to go beyond that, to get work that they find more meaningful. this is what human beings do. This is why we do this stuff. And this is what is so tough about this particular point in our history, is that people are feeling like, I'm sitting at home, I'm not doing anything. What can I do to make the world better? That's what I see out there, is this existential angst about that. People don't like to be idle. And so if we can make sure that people don't have to worry about these basic necessities of life, then people are going to be able to go beyond that, to do better work. They will be able to contribute more to society. They'll be able to pay more taxes. We'll be able to fix our infrastructure. Mm-hmm. So the question is, how do we do that? I think the most important thing is, first of all, vote. Vote, vote, vote. Anytime you can vote, go ahead and vote. Encourage other people to vote. Discuss issues with people. Discuss why this is important to you. And get involved in advocacy organizations around these things. Like I said, in Missouri Healthcare for All is a great organization to get involved with. And there are various others. You just have to Google and you'll find them. But thank you for asking that question.
Yeah, it's I 100% agree. Ken, when are you running for office?
Well, between medicine and my cabaret career, I'm pretty busy right now. I prefer to be a gadfly on the outside telling the politicians what to do.
That's fair. I mean, you're pretty good at it. So, I wonder, could you, this is kind of fun because I don't know how many cabaret singers I'll get to interview on the podcast. Could you tell me, like, what is the cabaret scene like? Is there a big one in St. Louis, or are you traveling a lot to other places?
Well, I have traveled. I've been lucky enough to do shows in New York and San Francisco and Chicago and stuff. Great. But there was a pretty big cabaret scene here in St. Louis. Mm-hmm. In fact, I was one of the owners of a really nice place called the Blue Strawberry, which was on Boyle, just north of Lindell. It was a cabaret room, and I say it is, because it will open again. But we were up and running for about 6 months, and we had brilliant people from New York and Los Angeles and from here. I did about 3 or 4 shows there. We had a great chef. But cabaret basically is the art of telling stories through song. So when I do a show, I figure what story do I want to tell. I find songs that illustrate that, and I have stories that I weave into it. The last show that appeared at the Blue Strawberry was my show called The Medicine Show, which is my own story about why I became a doctor, but how over time I learned that being a doctor is not the same thing as being a healer. If you like, I did do the show in New York in January, and I got a really good video of it. I can send you the link to it, and you can put it on put it up so people can see it. But that's what cabaret is about. It's not so much, believe me, I'm not a great singer, but I can connect to the lyrics of a song. And if a song has lyrics that touch me and I can show the audience how much it touches me, then it touches them. Yeah. So that's, and we do have a really big cabaret scene because actually St. Louis is the home to the largest professional cabaret training program in the country, the St. Louis Cabaret Conference, which takes place in July of every year. Right now, it is still planning on going on because it's small enough that there can be social distancing. But they bring in people from nationally known artists like Faith Prince and Marilyn Maye and Jason Grom, people like that who are just amazing teachers and performers and things like that. So when these people come to town, they're like, it's amazing. Cabaret is such a big deal in St. Louis. And I'm like, I know, it's so cool.
That's great. That's really cool.
Yeah.
Yeah. Well, let me see. Let me check to see if there's any other questions because I think we might move on to our game. This is great. I really appreciate you. This is a lot.
It's been a lot of fun.
Yeah, this is great. We even had a stethoscope going. Malcolm got in. I heard him barking in the background. He did a great job.
Yeah. Good I think the mail came.
Yeah, that's good.
He always barks at the letter carrier.
Yeah. Oh, that's fun. Yeah, mine. Who knows what he tries to do to the mailman? But thank God there's a window there, made out of plastic now. Yeah. All right, we're gonna play a game. This one is called Fact or Fiction. All right. So what I'm going to do is, and we'll start with one, kind of as an example, a little bit. But this is the cover of a book, and you know how you're not supposed to judge a book by its cover. Well, today, we're going to be judging a book by its cover. Several of them. So, folks, if you'd like to play
Okay.
along, you can go ahead and comment it there, too, and we'll see what you got so you can guess around with us. This is the cover of a book, and I have used a piece of paper. Can you see it okay? Moving it up a little bit closer. Can you see
I
it?
think I can. Yeah, New York
Yeah?
Times bestseller. Yes.
Yes. Okay, good. So you see that. So I've covered up this white piece of paper right here. Does not come with the book. Okay, it's all recycled paper. Don't worry. I have affixed this onto the cover of the book. And so your guess is not, unless you want bonus points, if you know what the book is, that's great. But the question is this book, based on the cover, fact or fiction? Fiction or nonfiction? That's the categories today. Fiction or nonfiction? Yeah.
Let me see.
Don't you Google imaging it right now?
No, I'm not.
Fact or fiction.
You want me to answer?
Oh, please. Yeah, let's see. Yeah,
I
go
would
ahead.
say,
No,
I would say,
You're the guest today.
I would say that's fact.
You're going to say
That
this
is
is fact.
fact.
All right. So
I would
his
say that's
guess
fact.
is nonfiction.
I'm saying it's nonfiction. I think it's something about the environment.
Oh, the environment. Oh, okay. Go.
Because there seem to be like little twigs and trees
Yes.
and leaves and things.
That's true. Very true. Okay. Environmental
Yeah.
nonfiction. This book is ready for the reveal. So if you're guessing at home, guess already.
Yeah.
If you're watching on the replay, too bad for you. You are correct. This book is
All right.
nonfiction. It is Just Mercy. It is not so much about the environment. It's actually about, yes, our justice system and some issues there.
Yes.
Brian Stevenson is a wonderful, wonderful attorney who's done some wonderful work, and this book is fantastic. I actually read it while I was an assistant attorney general during one of my trainings somewhat early on. And I was in Jefferson City doing the trainings. I was in a hotel room, and I literally read it in the entire, I couldn't go to sleep between trainings, and so I wasn't great the next day, but that's
Wow.
fine.
I haven't read the book, but I have seen the movie. The movie is really good.
I haven't seen the movie, so that's good to know.
Yeah, Michael B. Jordan and Jamie Foxx. Really, really good.
Yeah. Michael B.
I will have to read the book. You also watch the movie. We can
We'll do
compare.
it. Yeah, we'll compare. We'll get you back on. We'll compare it. That's good. Let's see. We're going to do a couple more. All right. Oh, maybe three more. We might do three more.
Okay.
This one's tough. I'm not going to do that. That's a great book. I could refer it later. All right, here we go. Got this book here. All right.
Oh, wow.
Okay. We've got some purple going on.
Okay.
Got a little
I'll give
clock.
people a second or two to answer, and then I will come up with my answer.
Okay. All right. Trying to hide. I should hide the side of it. So, all right, folks. If you got any answers out there.
Okay.
Okay. Oh, we got Lexi. Lexi says you've got to see Just Mercy, so she agrees with you on the movie. I've got to see it.
Yeah. I'm saying it's fiction. I think it's a book about time travel.
Oh, a time travel book. Time travel fiction. All right. Final answer.
I have a love-hate relationship with time travel. I love the idea.
Okay.
But the execution usually is like, no, that's not how it would work.
Very true. Yeah, there are some places that do it well. It's very tough to do.
Yeah.
Yeah. Are you a Star Trek
As Captain Janeway once said on Voyager, time travel, the past is the present is the past. It just gives me a headache. That's my Catherine Janeway impression.
Especially on Star Trek, I think that's very true.
Yeah.
I love slingshotting yourself around the sun to go back in time and save some.
Oh yeah,
great movie, by the way.
Oh, that's yeah.
All right, let's do the big reveal. This is Kurt Vonnegut's Play Your Piano.
It
is set in the future, so very true. Yes,
there you go.
It is set in the future. Still, I think
so far,
still in
2
the
for
future
2
to this day, if I'm not mistaken. I can't remember what year this thing is set in. It says at the beginning. 1952. Never mind. So it was.
That's even before I was born.
Yeah. Oh, yeah. It's a whole different. This is a great conversation about society and the function of it and what happens when we have robots running the whole world. So, all right.
That's right.
Yes. Okay.
Now we have Westworld for that.
We have Westworld for that. Yes, we have Westworld for that. All right, you've just. Oh, by the way, before I go to the next one, I'll put this one on the screen too. you just got a blessings for quoting Captain Janeway. So congratulations for
All right.
The Twitter people love it. They love it. Okay, here we go. So this is going to be our final one. All right?
Okay.
For all the marbles right here. Okay, so we've got this lovely book here. Okay, it's got some print around it. Mm-hmm.
Yeah.
Nice print. Very nice print around it for everybody who's taking a look and playing around with us. So the question is fact or fiction?
Well, it's published by Penguin.
Left a little bit there.
Yeah, so I'm thinking fiction.
Okay. Yeah. Final.
Maybe it seems a little skinny for Proust, but I'm saying fiction. I'm saying fiction.
Go with fiction. All right, fiction. All right, guessing at home, everybody. Time to guess, because we're doing the big reveal. This is actually a French phrase book.
Wow.
Yeah. I'm not really sure what
okay.
I guess reference.
Sacre bleu. Mon Dieu.
I will give a shout out since we were conversing about it so much.
Merde.
There was one book here, and this is so stupid. This is only white, so the whole cover is just white. I don't know what you would do with this thing. But it's a wonderful, excellent book. It talks a lot about philosophy and where we should go and how to really consider these tough questions. It is called Justice by Michael Sandel, who's a professor at Harvard.
Okay.
This is really great. If you fell asleep during all those philosophy classes, you couldn't stand Proust at all and all this other stuff, he goes over all of these and really talks about the different ways that we all, especially as Americans, look at different issues. And really great book. I've given this book away at least 4 or 5 times so far. So it's called Justice, and a great read, especially for now. So
awesome.
Yeah.
Awesome.
Great. Well, that was a fun game. I think we had some folks who were participating, and
all right.
Yeah, some folks actually they had some guesses out there too. So this is great. And now I have to see Just Mercy, and you've got to read it. So
I do.
Great. Well, Doc, I've appreciated you being on here. Do you have any parting thoughts or parting words or words of wisdom for the people out there watching?
I would say that this is just, well, as a gay man of my age, this is bringing back a lot of memories of the beginnings of the AIDS crisis. There are a lot of ways in which it's like it, ways in which it's not like it. But I will say that is the period of my life that formed me both personally and professionally.
Yeah.
It is something that I will always carry in my heart, all the people I lost and all the advocacy I did. And I would say that at this point, this is an opportunity for us to look into our hearts and see who we want to be when we come out of it. What do we want to tell future generations about the great pandemic of 2020 and what we did and how we were there for each other? So I hope that I would wish everyone stay strong, stay safe, stay healthy, and be yourself. Thank you.
Thank you. Well, yeah, that's a great way to end the pod. So thanks for coming on.
Thank you.
Appreciate all the work that you are doing and that you have done and the wonderful words you've had today. So thanks for everything.
Always a pleasure.
Yeah. Well, folks, that's the EladPod for this week. I promised you some news, so I'll put some stuff up for you so you can see. In just a little bit today, actually, we will be holding a text party. It's another one that we've done for the campaign, and it's a way that we have really been able to share resources with people throughout the state, get folks involved, let them know about the different issues that we're all facing, not only in the Attorney General's office, but really all over. Really, you can get on. If you've never done this before, it's a great opportunity to do it. We're all in a room together. We all talk about it because you can do that while you're texting. And it's a really great way to bond with each other and see the issues that folks are dealing with, a lot of them like the ones we've talked about today. And so if you'd like to register for that, we'll start at 3 o'clock today. If you can't make it quite at 3, you can only make it for a little bit. That's fine too. You can go ahead, go to the website, register, click the gold button. It's eladgross.org. And go ahead and click right there, and we'll have these on a regular basis too. So we'd love to have you. We also announced something very special. This is pretty exciting. As some of you know, I'm a big Parks and Rec fan, as are the rest of the team, and so many people who are involved in this campaign. And so Parks and Rec is doing a reunion show, and it will be on Thursday. They're doing a socially distanced show. So they're going to be doing that live on, I don't know if it's live, but they'll be doing it. They'll be airing it on Thursday. And so at 7 o'clock, we're going to be holding a virtual costume party. And that will go through the show. The show starts at 7:30. You can register for that too online, just to make sure that nobody's Zoom bombing is pretty much the idea here. So everybody's welcome. Bring a costume. If you can't stream it for some reason, but you can only listen, we'll have you call in. No problems. You'll just have to describe your costume for all of us, and we'll do a live watch show. So that should be a fun opportunity too. So folks, thank you all so much for watching. Thank you all so much for being here. If there's ever anything you need, please let me know, and we're happy to help. So remember, you can go and check us out on the website anytime at eladgross.org. We're all over social media all the freaking time, so you can find us. And everybody, please stay safe, and we'll see you soon. Take care.